Hello, Compassion Ambassadors. Thank you so much for tuning in. I'm really excited because today I'm talking with one of my favorite people on the planet, one of my favorite souls, lights on the planet, James Radina. And James has been the CEO and really been nurturing the growth of this incredible company called BioCBD Plus. I've watched it grow from an idea and product in your garage to really this incredible international brand, right? I mean, how big are you guys now?
Well, we've been shipping to all 50 states and 40 countries since the beginning, and that was part of the loophole that we saw early on, thanks to some people I used to work with that kind of showed that if you get your CBD from hemp, then it's a whole different landscape. And we've seen in the United States kind of like different laws change, especially even just this last year with the Farm Bill. But for the last 4.5 years, this company has been shipping water soluble CBD all over the world. So
Wow,
an
I love it.
exciting year and plenty of ups and downs, like all of life is.
Yep. And like the journey of becoming whole and healing. It's not linear. My dear friend Linda, who I'm living with now, actually reminded me the other night, you're not on a linear timeline. You're actually essentially in a maze, like in a walking, meditation, walking spiral. And you're constantly, as you're going through layers, moving ahead. And when it feels like you're sliding back, you're actually moving ahead. You're just sort of pulling back to the core to rise again. And I think working with plants such as CBD is a really important process of a part of that process of becoming whole and rising again. And so that's what we're talking about today is what the role is of CBD in optimal health. And I can't imagine a better person to talk with than you because you've been so dedicated to this. You pour your heart and soul into it. I know that you pour your heart and soul into making sure that all of your compounds are of the highest quality and so forth. So what comes up for you when you hear that sort of statement? Like question, what's the role of CBD in optimal health?
What comes up for me is that, I grew up on a farm in Kansas. And so for me, my journey started with my hands in the dirt doing 6 a.m. chores all summer long, every single day while my friends got to sleep in because they're playing video games all night. But we ate so healthy because everything was grown outside of our back door. And I didn't realize it then. I was in middle school and high school, and I didn't really appreciate vegetables and I didn't really appreciate home cooking. But then when I moved to Southern California, or just in college, and I started to see how other people ate and how the rest of the world was operating, I started to find my own journey with that. And so, in a way, BioCB Plus is a reflection of my own journey to get back to nature, to get back to, plants and nature being all we really need for optimal health. And so, CBD to me is an expression of one of the greatest gifts we've been given by this incredible planet. Pachamama has been giving us this plant for thousands of years. They've been talking about cannabis, and CBD is just kind of this latest piece of it. But it's one of hundreds of parts of the cannabis plant. It just happens to be one that's finding remarkable testimonials, remarkable case studies, remarkable results from kids to elderly, from entrepreneurs to people just kind of hungover and wanting better sleep or wanting deeper sleep. It's across the board, across 40 different diseases now with different clinical trials started. So, but at the end of the day, it's just a plant. It's really just an all natural molecule that's, in our case, we just want to continue to push for the idea that to keep it as pure as possible, to keep it as God intended, as nature intended, without trying to isolate a certain part of it, but to keep this whole plant entourage effect inside of our products so that, again, we're not, I'm just a steward, really. I'm just happen to be in the middle of the earth planting, the earth giving us hemp CBD, and then me being in the middle to bring it to people that want it.
That's interesting you bring up keeping it as natural as possible because my friend Caden, who is Linda's son, who I'm living with now, was talking about the other night how pharmaceutical companies are kind of trying like trying to take the ball that has been rolling with plant medicines and find compounds or sort of extract things and make synthetics that are similar so that they can be sold as, official pharmaceuticals. And we had quite a debate about that, because again, if you're just extracting one aspect of the compound and then making something synthetic, then you're actually missing out on everything you just explained, which was the medicine that comes from ingesting the plant, the whole plant.
Yeah.
So I'm sure you have some thoughts about that.
It is. It's, how you do anything is how you do everything. First of all, is like a philosophy that I keep seeing. And so when you have organizations that are, well, the system that we live in, let's start there, requires pharmaceutical companies to go through rigorous tests and studies, right, in order to get something approved that show that it's safe to be able to give to the public world and make, what they're ultimately trying to do is make a certain claim. They can go to a doctor and say, hey, for this type of epilepsy, then try this drug that we've gone through. Usually it's about a 10-year, $100 million path, if not more. That's on the light end of trying to get something to prove that it's actually safe for people to take for this form of epilepsy. Well, that's a lot of money in order to go down that path based on the system that we have. And so to protect your interest, then you need to create something. If you're a pharmaceutical company, you need to create something that's unique to you. Otherwise, if it's something that's on a tree bark and anybody can get it, the second you go and prove it, then everybody else is going to go grab that tree bark and say, hey, this is also working. X company proved it for me. So they go and they try to create something that's exclusive to them. So a lot of times that means that they isolate a version of that tree bark down in the Amazon, and they come back and they say, we're going to patent this, we're going to do the test, and then we're going to prove it, and then we're going to go to market with it. Or they'll look at that tree bark and say, the molecule that's active that we think is what's actually working is X, so let's create in the lab a synthetic version Y and go to clinical trials on that. Nobody else has this, so we created this out of nothing, and we are in a system, in a model that rewards us as a pharmaceutical company for being profitable. And so that's what we're interested in: patenting, protecting, patenting, isolating, etc. And yet, on the flip side of that, if you look at Mother Nature and her intelligence, it's absolutely beautiful over and over again. And now, thank you to science and people that are interested in studying what we call whole plant or entourage effect, that we're starting to see that the actual entire cannabinoid profile, let's take cannabis for an example, the entire cannabinoid profile, the entire terpene profile, all the different parts of the cannabis plant are so much more powerful than one piece of it. So if you grab just CBD out and you only sell isolated CBD or synthetic CBD, there is now clinical studies showing that the entourage effect is more effective than this one little molecule of CBD. So if you have 10 milligrams of whole plant CBD versus 10 milligrams of isolate or synthetic CBD, it's now proven that this is more effective than the whole plant entourage effect.
Wow.
So is that possible in pharmaceuticals? I don't know who's going to really go and test it across all these different drugs, but we're starting to see that here in the CBD industry. And that's one of the areas that has been really exciting for me. Just to wrap up on this, this little train of thought, is that one of the visions I've always had is that we can actually change the way things are done in our healthcare system with something like cannabis that so many people have a charge about. There's so many people that believe in it and have been using it for years, our parents, etc. And then there's all this negative propaganda that was thrown at us in school from the DARE program, etc. And then there's all this green rush and this opportunity that's happening. But I'm always been curious as, can we keep it pure, or will it fall into the same kind of category and system as the pharmaceuticals do with everything else? But because it's kind of like, I don't know, almost like it's been grassroots for so long. It's been the hippie movement or the alternative health movement, or the people that are a little bit open-minded to be able to use it and see the benefits of it. Can we and them and us take it and keep it pure all the way through? It's been an interesting thing to watch.
Oh, absolutely. And I feel really good knowing that you're on that mission. So thank you. I know the right person is involved. And, if you really think about it, it's like the body is a miracle. And, and our system of things, this physical system of things, recognizes what Mother Nature has to offer. So, in the process of becoming whole or healing, what I'm finding is it's just so important to nourish the body for the optimal healing environment. Like, ultimately, the body, when it's supported um, and sort of, when it's supported in its process of healing, it knows how to heal itself. So I feel like that's a really important role for CBDs. Can you tell us a little bit about the endocannabinoid system?
Yeah. So, and I just wanted, something's coming to me. It's like, it's kind of, will tie the pieces together. So
Mhm.
um, you want vitamin C or you want vitamin D. You can take a capsule that maybe it's just an isolated version of vitamin C, right? 1,000 milligrams of vitamin C, and it's really just an isolated version of vitamin C. Or you can go outside and grab an orange and bite into it and get the entire kind of entourage effect of vitamin C, right? I don't have any clinical studies in front of me, but you can get the effects and the difference of it. Same with vitamin D and going out in the sun. And so our bodies are miraculous healing systems. I don't believe anybody can not argue, or anybody can argue that. And so what we've continued to discover, thanks to science, is that new levels of just how miraculous it is. And one of the things we discovered in the last 30 to 40 years that wasn't even talked about or written about prior to this is that we have a system called the endocannabinoid system. And the way I like to explain it is that, prior to this system, we thought the nervous system was the largest system in the body. But if the nervous system is the highways and freeways to entire system throughout your body, then the endocannabinoid system is like the dirt roads and the back alleys. And it goes and it talks to everything in your body. It talks to your brain. It talks to all your organs. It really helps support and maintain your entire system. And so we have these receptors in our body we just found out about, that actually, like opiate receptors we have in our body, like nicotine receptors we have in our body, we have cannabinoid receptors. So that the cannabinoids that are found in the cannabis plant, our body is actually meant to receive that.
Mm.
And what we're finding with the system is that when we receive the proper amounts of it, we're back to when it's in balance. Again, not too much and not too little of anything, right? When we're in balance and with what our endocannabinoid system needs, then we can start to do our body can start to do its own healing.
Right.
And that's what I believe the ultimate process, goal, result that we're all looking for is how do we allow our body to do its own healing, because it's an incredible intelligence. And there is not one answer for every person. There's not just one supplement or one pharmaceutical drug or one path of healing arts that's going to work. It's a whole system piece, and everybody has to find it. And if our systems, like our endocannabinoid system, are operating properly, then it gives the body a better chance of actually healing itself.
Yeah, and I think it gives you a better chance of being able to find it, because the one thing that is true in the process of for healing for everyone is that the foundation is your listening. That's what I find is one of my most important tools, and has been for over 20 years. My ability to be in relationship with my body and to listen and to know, and then I'm in partnership with my doctors, but we're both working together intuitively and practically. And one thing that I find is that when the endocannabinoid system is starving or hungry and the nervous system is, frantic and somehow disjointed, it's really hard to hear. So there, and I think that has to do with the fight or flight sort of function that happens. And most of us are essentially living in sort of crisis realities, no matter if it's from a health crisis or a financial crisis or a romantic crisis or some made up work crisis of, you just won an award, but now you want to win the next award. We all have some sort of, crisis that we're sort of managing. And I find that it's so important. I work a lot with the nervous system and the brain, and I love how you describe the endocannabinoid system as like a connector, it sounds like.
It's absolutely a connector. And what you're talking about, I think is so beautiful, is that, we're becoming and trusting ourselves to become our own best doctor. And the relationship with our health practitioner, our doctor, is no longer one-sided, where we rely so much on everything that they say. and what they've studied. And we can use examples, at least for me, that the fact that most doctors don't have more than just a few hours of nutritional study in their medical school, right? So things like that is like, okay, is it, would they admit it? I don't know if all of them would, but many of them are now.
Mm-hmm.
There's certain things we just don't know. And the information we're getting fed, and they're also now showing that the pharmaceutical industries are teaching a lot of the, how to dose and how to take pharmaceuticals, how to prescribe. There's a lot of influence in medical school by the pharmaceutical industries. So these things are known, right? So if we rely completely on them, and we might not be seeing the full picture, they might be giving us what worked in a clinical trial. A lot of these clinical trials are not, well, none of them are 100% successful. A lot of them aren't actually that high of a percentage, but it's enough for to be the better solution than doing nothing for a lot of these people that are suffering. So, when you look at pain, for example, and the opiate crisis, what other choice do people have when they go see their doctor and they're in chronic pain, for back pain, let's say, and the doctor wants to help them, but all they know is opiates. It's all they know. And so there isn't a nutritional path for them. There isn't anything. So what we're talking about is that, okay, maybe go see your doctor, maybe look at that path, but also what about looking at other things that might be able to support your pain? Better sleep, right? Whole nutrition, whole plant nutraceuticals and supplements as an example, getting outside into nature, whatever those things are, yoga, resting the mind, resting the body, et cetera, et cetera, et cetera. It doesn't need to be just relying on the doctor. We can actually become our own medicine. We can actually become our own best doctor.
Yes, and that's our sort of path to becoming whole. And at the root of that, like I said, is the ability to hear. And you're not going to be able to hear when your nervous system is in fight or flight, and you're going to be easily knocked into a fight or flight when your endocannabinoid system is out of balance. And so, I'm very solutions oriented. Growing up in a house of engineers and innovators and creators, like I'm always like, wait, that leads to that, leads to that, leads to that. Okay, so I just need to know what the foundation is. I need to be able to hear and listen. And I can hear and listen what my body needs so that I can become my own healer and be in better partnership with the healers in my life when my endocannabinoid system is in balance. So I think that, it's a really, really, really important role. What's interesting and what people often have the question of, and people are asking me a lot, is like, well, what about hemp CBD versus THC, right? All these different ratios. And so just in wrapping up, I'd like to just have some clarity about that and talk about some of the products that you offer and how people dose them.
Okay, beautiful. So where can we start? We just take this plant, right? It's grown in the ground, plant a seed, water it, fertile soil, and up pops this plant. And this cannabis plant, there's two sides of it, marijuana and hemp. Female side is marijuana, produces these big, beautiful buds that people are known for, usually grown for its high THC psychoactivity, the part that gets you high and stoned. Hemp, the male plant, doesn't really have these big old flowers and buds. Lately, they're starting to grow it, so it's that way, but it's these leaves, right? It's a male form. They actually, when they're harvesting or when they're growing, they separate the two so that the female side gets kind of sexually frustrated and grows these big, voluptuous buds, and it's full of all these incredible parts of the plant, all these different cannabinoids. Anyways, inside of both of these plants, CBD, THC, CBN, CBG, I could bore you trying to list off 300 of the different parts. But now science is starting to study these different parts, and one of them makes you high, the other one doesn't. One of them suppresses your appetite, the other one doesn't. Both of them support with pain relief. Both of them relax the body. Both of them support with anxiety, certain doses. One of them you get really paranoid when you take too much of it. Things like that. We're starting to study the effects of this, but ultimately what we're dealing with CBD, which produces a large percentage of the cannabinoids that are found in these two sides of the plant. CBD is beautiful with a number of different things like stress reduction, better sleep, reduction of pain, neuroprotectant, all these different parts that are actually help. Your endocannabinoid system is doing the work, but it's helping your body really relax. I like to say CBD is really just like an internal massage. Your body's relaxing, it's allowing itself to do the healing that it's meant to be doing, because we think we know what's really going on, but there's a lot of layers to any kind of symptom or surface thing. So anyways, back to your question here about what CBD, whether it's hemp or marijuana, at the end of the day, they both produce the same molecule. CBD, the molecule of CBD is the same in marijuana and hemp. And so just a matter of really what you're looking to do. If you're looking to have a nationwide legal aspect, then that's why hemp is really important. If you're looking for something that really doesn't have THC, the psychoactivity, that's why hemp is important. If you want a little bit of psychoactivity, or you want more of that entourage effect than even what hemp can provide, because the law states we need to have under 0.3% THC. So it's really just micro dose, like minute amounts. You're not really getting high, but you have enough to have a little bit of entourage effect. And so anyways, depending on what you want, you can experiment. And this is back to, there isn't just one path for everybody. I'm not going to say that Bio CBD Plus is going to work for everybody. We have a money back guarantee. 99% of our customers don't return the product. So I'm not saying it works for 99% of the people, but with a money back guarantee, we always just say, try it. If it doesn't work, ship it back. We'll give you a full refund. And only 1% of our customers ever do that. So they're finding relief and across so many different diseases. So we came out with a CBD capsule, easy to take, 10 milligrams of water-soluble CBD mixed with curcumin and magnesium. And it's a beautiful product. This is our flagship product. Right behind it, we launched a topical oil that's for the skin. Skin scrapes, bones, muscles, joints, aches, things like that. Just apply it on the hand, put it on the back of your neck or on your low back or your knee. And our third product is a vaporizer. We mixed in essential oils, whole plant CBD. We got lavender, lemongrass, bergamot, and clary sage in this. And it comes with a little pen, and you just push a button and you inhale the CBD. And through that, it goes into your lungs, passes into your blood, and you feel the effects of it within a minute. And that's really nice for like a calming, relaxing internal massage throughout the day. So
that works too. I woke up in a panic one morning and was like, went straight for that, and it worked instantly. I mean, within a minute, I was like, okay, my feet are on the ground.
Yeah. Over and over again, we give it people, and this can be felt within 60 seconds. Mm-hmm. Capsules, bioavailable format, 15 to 20 minutes. Mm-hmm. Oil-based format, which we don't sell, you're looking at maybe an hour to an hour and a half a lot of times. Mm-hmm. So there's a faster uptake time with these, and that way it helps with the dosing, helps with the safety and the efficacy of it. And so you can take a lot less to reach the desired effects. Is kind of how we built this company.
So you would maybe take the capsules on a regular, like for your daily maintenance, for your optimal health. And then if there's a peak in stress, or there's a certain time of your day that you have more stress, you might turn to the vaporizer for more immediate. And then if you're having a strain or something, menstrual cramps or something, use the oil.
Yes, exactly. For me, I'm on calls a lot on the computer. So throughout the day, I'm hitting the vaporizer just a little bit here. And there's no mental change whatsoever. It's just really just a calming. And so I like to call it a clear focus. I just kind of come back to the present moment. So I like to do that throughout the day. And then, I take the capsules, in the morning, just to kind of give me an overall peace throughout the day. And then I like to also take them at night, because I have found for me, I'm dealing with, I've been an entrepreneur for 25 years. I've been dealing with my own stresses. Sleep is super important. And so it allows me to have deeper sleep when I take them right before bed.
Mm. Perfect. Well, I'm so excited and thank you so much for your generosity that we're able to offer a special savings and price on this to the Network of Love, to members of my Network of Love. So you can find that over on patreon.com/Network of Love if you happen to be watching this on Facebook. And if you're not part of the Network of Love, I'll still have a link for you that will be an affiliate link so you can get access to this. I think this is one of my most favorite products, one of my most favorite CEOs, one of my most favorite missions out in the world, and just a pillar in your process of becoming whole. I can't encourage you enough to make this part of your daily ritual. So thank you so much for taking the time. Thank you.
It's stories like that and case studies like you and so many others that really make it so fun to get up and actually be in service every day. So thank you for having me. If anybody has any questions, feel free to reach out, James at biocbdplus.com. But head over to Heather's page and let's get you hooked up. Money back guarantee and a discount for your first order.
Perfect. Thank you.
Aloha.